multiple sclerosis, MS. It is disease of the central nervous system and spinal cord. It is an autoimmune disease in which the aggressive attack of the faulty and misjudgment of the immune system of the human body that attack the myelin sheath of the neuron and the axons of the central nervous system and the spinal cord. Myelin sheath is composed of a typical protein material which is normal for the human body and essential for the function and conduction of the electrical impulses generated by the neurons in the central nervous system to convey these stimuli onwards to the various centers of the central nervous system and onwards to the spinal cord. The immune system that take it an abnormal or the foreign body to the human body in the patient suffering from this MS, multiple sclerosis. So, in this process, the immune system come into action as usual as it invade the foreign body pathogens entering in the human body. They crosses the blood-brain barrier. First, the leading one is the T cells, then afterwards B cell and the macrophages. They also come into action and they also passes they penetrate the blood-brain barrier and crosses enter in the central nervous system. And they attack the myelin material, protein material, destroy it and disturb the conduction of the electrical impulses. In this process of invasion and attack of the immune system, there is production of cytokines, inflammatory chemicals. They also destroy the myelin sheath material and also the surrounding cells of the neurons. Whereas the macrophages invade and digest the dead cells and the material, debris. In this way, the fibrosis or the collection of the fibrotic material is deposited in the white cell of the central nervous system. These are called as plaques or the lesions, and that is why this disease is termed according to the scan of the MRI, multiple sclerotic disease. The outer portion of the exterior of the brain is composed of gray matter, that is the collection of the neurons. The inner portion of the brain is consisting or called as white matter, which consists of the fibers of the neurons, that is axons. So there is damage to the axons, neurons, and due to this degenerative and inflammatory progressive disease, they lead to the dysfunctioning of the body. If these sclerotic lesions appear in the pathway of the motor pathway, so the motor function of the body become distorted, sluggish and dysfunctioning upon. Difficulty in speaking, swallowing, talking, walking. Similarly, when there is the obstruction in the sensory pathway, so there is paresthesia, that is numbness, tingling, sensation in the periphery of the body, especially in the skin of the arms and the legs. So this is a disturbance in the sensory system, while in the motor function disturbance there is weakness of the muscles, muscle pain, there are tremors, there is the fatigue symptom, and ultimately that may lead to the paralysis of the muscle groups. So the activity of the patient is retarded or obstructed. So person suffering from this disease cannot perform his motor functions properly and purposeful manner. In addition to this, the main factor, the symptom is there is neuritis, optic neuritis, that produces retinitis, papilledema, blindness, and also the muscles of the eyes, they become weakened, and that produces nystagmus. There is blurring of the vision, diplopia. The most drastic symptoms are the ocular symptoms, that is the disturbance and the blindness of the vision of the patient due to attack of these immune system cells over the optic nerve. So while other nerves outside the nervous system, they are not suffering from the attack or the action or overactivity of the immune system. Only the optic nerve is the suffering one. In addition, nervous system is also affected due to which the functions of macuration, function of defecation, and these similar functions, they are also destroyed or the disturbed one. There may be constipation, there may be dysuria, similar symptoms they appear in the patient. So collectively, then there is cognitive disturbance, that is the person suffer from hallucination, depression, anxiety, stress condition. There is diminution in the memory, and intellectual activities is also diminished one. So overall, the main symptoms of the motor, sensory, cognitive functions, they are extremely disturbed by this chronic progressive neuroinflammatory disease of the central nervous system and the spinal cord, which is called as multiple sclerosis, because MRI scan shows multiple lesions, that is the collection of the dead cells, fibrotic cells within the white matter of the brain. So that is why it is called as multiple sclerosis. Now the diagnostic feature is very clear one according to the symptoms of the patient, neurological examinations, and then is the MRI scan, which may be direct one or by means of injecting contrast material to make the more clear evidence of the lesions or the plaques in the white matter. Moreover, examination of the cerebrospinal fluid for the detection of the antibody produced by the immune system against the myelin protein. So these are the basic diagnostic features or the procedure which are adopted for diagnosis of this multiple sclerosis.